Dan and Amy. So, Amy, when we have a virus that reaches epidemic proportions, sometimes we have people get a little unnecessarily hysterical. And so you try and infuse the conversation with what we know from science. You remember the 2014 Ebola outbreak in West Africa?
Yeah, I sure do.
And we were all going to die from Ebola. I'm not discounting the seriousness of those people that were infected and perished. It's a horrible death.
Horrible.
But you just want to have some sense of proportionality and separate.
And I got all angry when they brought them over to this country to be treated.
Right,
Thought they were
exactly.
putting American lives at risk.
Right, silliness. So we want to
Okay.
separate science from hype and unnecessary fear. And this Zika virus outbreak, with this virus that's being spread by mosquitoes, most notably in Brazil. Brazil has sent 200,000 soldiers into the hinterlands to stop the spread of the outbreak, which has seen huge numbers of babies born with microcephaly, which is like abnormally small head and brain damage.
Oh,
I mean, people have referred to this like Beetlejuice heads. That's a little
Well, it's-
insulting. This is serious.
I know. And then there's a woman in Hawaii who was in Brazil who gave birth to a baby who had a very small head.
Right, and so that's one aspect of it, and then there's this whole discussion of whether it's going to come to North America, and there's a lot of suggestion that it ultimately will. How it's spread, in terms of is it just mosquitoes, or can it be spread through carnal relations, as the New York Times.
Or as I call it, sex.
Yeah, as a New York Times story suggests, 2 cases suggest that it could be spread through sex. And there was one test positive, at least so far. Centers for Disease Control confirmed yesterday afternoon that an Arkansas resident had tested positive for the Zika virus. So you just kind of want to get a handle on this. So as I said at the outset, we separate science from hype. And to help us do that, we're now joined by Tara Smith. Professor Smith is a emerging infections professor at Kent State University, the Golden Flash, if I'm not mistaken.
Absolutely. Good morning.
Good morning. Thank you for joining us. Appreciate it. So you direct the Kent State Center for Emerging Infectious Diseases. Tell us what we should understand about the Zika virus and how much of a threat it poses at present.
Okay, so for the United States, it still is not really a big threat here. We have had cases of people diagnosed with Zika, and as you mentioned, the woman in Hawaii whose baby was born with microcephaly that they think is probably related to a Zika infection she contracted in Brazil during her pregnancy. But for most people, it's not anything to be concerned about right now. We do have the mosquitoes that can transmit it, but they're mainly in the southern parts of the United States, and we have not found any evidence of mosquitoes being positive here in the United States yet.
Now, is this just a concern for pregnant women, or is this a concern for everyone in terms of what are the, if you get infected with a virus and you're not a pregnant woman, what's the impact?
Anyone can be infected, but actually about 80% of the cases are asymptomatic, so people would never even know they had the virus. The other 20% mostly get a fairly mild disease. It can cause kind of flu-like symptoms, headache, rash, muscle aches, things like that. But that's one reason why it's been, kind of ignored. We've known about this virus since the 1950s, but it hasn't ever been in the Americas before recently, and it doesn't really cause a lot of, fatalities, deaths like we saw with Ebola.
How can you be tested for the virus, and is there anything you could take or, to get it out of your system?
Mm-hmm. Right now, the only testing that's being done is through health departments and the CDC. Again, because this is very new, not a lot of places have kits that have the reagents to do all the testing. So it's all through kind of national organizations right now. And unfortunately, there's nothing you can do about it right now. We don't have any kind of antimicrobials, antivirals that will work against it. So really, if you have it, the treatment that they recommend is just, rest and fluids and things like that.
And what about the spread? It cannot be spread person to person. It's just through mosquitoes as the carrier.
Mosquitoes are definitely the main way. As you mentioned, there are some suggestions of the possibility of sexual transmission, mostly anecdotal right now, but that's definitely something people are looking into to see how common that is, if that's really happening, and things like that.
So women who are pregnant, there's a list of countries that have, known cases of the Zika virus. Should they stay away from places such as Puerto Rico, Brazil, parts of Mexico?
That's what the CDC is recommending right now, that if there's no need to travel to countries that are currently experiencing outbreaks, and I think it's up to about 24 countries right now, they recommend pregnant women don't go there. So obviously it's depends on what their travel needs are, but if it's just a vacation, and especially if it's an area where they know that there is a city where the virus has been causing outbreaks, they recommend that pregnant women stay away from those.
And if you do have to go, bug spray, is that the only solution, or covering up
Right,
exposed skin?
trying to avoid mosquitoes any way you can. So staying inside in screened areas that are air conditioned and would be closed off, using bug spray, using clothing that will protect your skin.
Brazil notes almost 4,000 microcephaly cases. Previous annual average in that country was 160. So, I mean, it's a serious spike. And, of course, the implications are serious when you're talking about birth defects in children. If you are a pregnant woman, is there something that you can do if you have these flu-like symptoms to understand whether or not you're infected, and anything you can do about it, or what's the recommendation there?
Yeah, so the CDC has recommended kind of two tiers. So if you have been to a country where an outbreak is occurring and you do have symptoms of Zika virus, they recommend that you do get tested for that. So you go to your practitioner and say you need this test. If you've gone to a place but you haven't had any of the symptoms, they still recommend you notify your doctor and you get like extra ultrasounds and things like that to specifically screen for microcephaly, and so that you're a little bit more highly monitored throughout your pregnancy.
I mean, Brazil, they're having the Olympics this summer. I mean, people are coming to Brazil. So what are they doing to try and combat this?
Right. Well, as you mentioned, they sent out 200,000 soldiers to try to control mosquitoes, really. So if you can eliminate the mosquito vector, then you really reduce the threat. So that's what they're trying to do right now, is to really ramp up their mosquito control, try to stop transmission of the virus before the Olympics.
If you do get infected with the virus, does it necessarily mean your child will be born with microcephaly?
No, and that's one of the big questions, is that even with Zika outbreaks before this, before it came to Brazil, they hadn't seen that specific manifestation in pregnant women. So we don't know how common that is. We don't know if you have to have a symptomatic infection in order for that to happen. We don't know, what the chances are if you get that, if it's 1 in 10, if it's 1 in 100, that if you're infected with Zika while pregnant, that this will happen to the developing fetus. So there are just so many questions right now that we unfortunately don't have the answers for.
It's interesting. You mentioned that we've known about this virus for almost 70 years. I didn't realize that. I hadn't read that to this point. And so I guess, is there a history on the virus in terms of it mutating and different and more virulent strains of the virus?
Yeah, again, there's not a lot known. Zika is one of what we call a neglected tropical disease. So an infection that we know about, but not a lot of money is spent to investigate, because it mostly, it doesn't cause a lot of deaths, and it mostly circulates before this in impoverished developing countries. And so the wealthier countries that spend a lot of money on research, like the United States and like European countries, haven't really had to invest in that because it wasn't a threat to us previously. So there are just so many unknowns with this, even more so than with Ebola.
Okay. She is Professor Tara Smith. She directs the Center for Emerging Infectious Diseases at Kent State University. Professor Smith, thanks so much for joining us. Appreciate it.
Thank you for having me on.
And she joined us on our turnkey.pro answer line.
There's only